Hey, all you cool cats and kittens, let's talk chest tubes. As a tech and the RN in recess or in trauma, your primary responsibility when helping insert a chest tube is going to be to have your atrium completely ready to go, hooked up to suction for your resident. To set this up, you need to make sure that you have the water sealed chamber, which you can grab from trauma and or recess. You will also know that this is the correct one because it will have a red line down the side of it. If it has a green line on the side of it, it is not accurate, and make sure you need to find this one. You will open up your atrium. And this is what it will look like. This water sealed chamber is where your blood or air will drain down into here, and you can keep track judging by the markings on the side. Along with that, you'll find there's a blue dye marking inside this, along with your suction gauge at the very top. To set this piece up, you will rotate around and grab the water that's contained on the back, like so. You will take that water and pour into the tab on the top. Releasing the water down, it will hit the blue dye, turning your water blue. All this is for is just so you can visualize the water once you hook it up to suction. After draining all of your water, at this point, you will take your 20-foot suction and connect it to suction. You will connect one side of the suction to the atrium itself in the exact same spot you poured the water into. And the other side of your suction will be placed at the head of your bed to your normal functioning wall suction. Like so. You then will turn to continuous suction, and I like to keep it right at about medium. Regardless of what you set your suction at, because we do have the suction gauge on your atrium itself, it will never get past this point. You then take your chest tube, releasing the handles at the top, and can place it directly onto the bed itself on either side where placement of the chest tube is going to be. You can also set this on the ground by twisting the bottom. However, I don't advise that due to it can fall over. So we hook it straight to our bed. You can notice that the water now is at a boil. This will disappear once this is connected to the patient, regardless if it is a pneumo or if it's a hemo. If it's a hemo, you will see blood coming down through here, and if it's a pneumo, then you will just have air. This indicator right here is indicating that your suction is properly working. You will not see this unless it is hooked to suction. On the back of your chest tube, you will have your connector. This piece has to stay sterile. This is what's going to connect to the patient's tube. You will take this piece, not touching any of this top part. When the resident is ready, you will hand this to them. At that point, they will connect this directly to the chest tube that is inserted inside your patient. That is all you are primarily responsible for as the RN or the tech taking care of the resident who is going to be placing your chest tube. However, there are some key things that you should also be aware of that your resident may not understand or may not know about, such as other supplies. In our boxes, which we have located in trauma, we have 5, recess has 1. In our preset boxes, we have 15 different items that go into one chest tube possibly. We have our chest tube kit, which is going to be for your resident. This is sterile. You are not able to touch anything inside of this. Your resident will touch everything once they are sterile. You will have 7 different sizes of chest tubes. It's very important to know which size your resident wants, so that way you can already have it out ready for them. In a controlled environment, you will have your sterile gowns for your resident, two, one for your attending and one for the intern that's going to be placing it. You have your sterile U-drape that will be applied over the top of the patient to keep the site sterile. You will have your restraints, which is going to be for when they're prepping to the patient for the chest tube. You can at this point raise whichever side of the site is that you're going to be inserting. You can raise it above their head and have them restrained down to the bed. You also need to have the other arm restrained as well, just because they might come up and grab the sterile field and or grab the doctor. You have sterile towels for the resident. You have gauze for the resident as well. This they will end up pouring iodine on if it's an emergency situation, or they will use a chloroprep. Once the chest tube is in place, you have connected it to your atrium, everything's good to go. It's going to come time to dress it. In our dressing, we keep 2 0